Welcome to a new episode of our weekly web series, Science in Context. This week we focus on malaria, a life-threatening disease caused by parasites that are transmitting to people through bites by infected mosquitoes. Yearly, there are more than 200 million cases and over 600,000 people die of malaria, mostly children under 5. I'm Sabine and joining me today is Professor Tom Churcher. Tom, what is the biggest threat to malaria control at the moment?
Malaria has been controlled very effectively since the year 2000 and the number of cases have dropped year on year, mostly through the use of insecticide-treated bed nets. Over recent years, the kind of advances have stalled and cases are starting to go back up again. And so we're increasingly worried that the advances that have already been made are under threat. So one of the reasons for this is that mosquitoes are developing resistance to the insecticide used on insecticide-treated bed nets. So in the past, these mosquitoes came to try and take a blood meal, hit the net and died. And this provides a public health benefit to not only the user of the net, but the whole community. But now mosquitoes are increasingly resistant to this, and so there's fear that this may be increasing malaria cases worldwide.
The Malaria Modelling Group at Imperial has developed a tool to support malaria control. Can you tell us more about this?
Yes, so this work has been led by Sherrard-Smith. There's lots of different ways to kill mosquitoes, and we're trying to understand what's the best thing to do in a particular context. There's a new publication out from colleagues in Tanzania showing how a new type of bed net with a new type of insecticide could be used. Now, these interventions cost more, and so what we want to do is justify use of these more expensive methods by using mathematical models to predict how good they are at controlling malaria in that local situation. We've developed an online tool that allows local program managers to understand what's the best combination of control tools that can be done to reduce malaria in their setting.
How will this tool be used?
So we're working closely with scientists in, for example, Burkina Faso to work out what information they need to make the best decision about what type of malaria control to use. And so they're collecting data on the mosquitoes and looking at the goals of the control programs, understanding the cost of the different products, and to work out what's the most cost-effective thing to reduce malaria and save lives.
Thank you for your time.
Thank you.